I wanted to bring today's episode to the podcast talking all about genetic testing. This is different than the genetic testing that you're doing with your fertility clinic. This is looking at your specific gene variants and what are the targeted diet, lifestyle, and supplement recommendations to support these gene variants. So you're in a very powerful position right now to improve your preconception health and knowing exactly what your genes are telling you, where you're deficient, where you need support, what the exact lifestyle and diet and strategies you can take right now to improve your chances of pregnancy success, especially if you have experienced pregnancy loss. I'm excited for you to listen to this episode. Let's go. Hey, Helen, excited to have you on the podcast.
Hi, Sarah. Thanks so much for having me. I'm excited to be here.
Awesome. So before we get into our topic, talking all about the GrowBaby test, let's talk about how really you came to work in this field to share your story with us.
Okay, so my background is as a dietitian, and I think many years ago, it started becoming quite frustrating, the area of trying to give recommendations to individuals. One, them not following them because behavior change is a major barrier. And two, almost seeing quite a lot of generic advice being provided. And I was working in a hospital setting where I really enjoyed working with children, moms and kids, and actually this almost coming full circle around to being able to develop this test eventually. But I think that disillusionment around how practice was going many years ago, and I think possibly for some practitioners still, moved me into a space where I wanted to find out how it could become more exciting because of the whole field of nutrition actually healing and lifestyle healing an individual. And that's why we got into it in the first place. And so I came across actually an opening that was being advertised at a company in South Africa called D-Analysis. And they are part of DNA Live. And this company offers genetic testing, nutrigenetic testing for personalized healthcare. And it's grown and grown since then. But I just, as I stepped into it, it just really called to me and showed me a different way of practicing, understanding what is happening at the molecular level to improve health outcomes and how much one can do by understanding not just a specific phenotype, the diagnosis, but what is driving that and how can we, through a multifactorial approach, improve those.
Awesome. Yeah, I'm really excited about this. So we offer, as part of our testing, we do food sensitivity testing, we do stool testing, looking at the DNA of the stool. We also do genetic testing as well. And then we discovered just recently bringing on the GrowBaby test because the test we were doing was female hormones. It was still really good, but this is specifically for preconception health, for pregnancy, and so we're really excited to be offering the GrowBaby test to our clients. And it really helps because so many people are reading, there's a lot of information in the fertility preconception field about doing, these fertility superfoods and taking a whole bunch of herbs. And most people that we speak to are taking a boatload of supplements, like as you're, probably familiar. A lot of that can be generalized recommendations. Maybe you just have expensive urine. So I love the fact of the genetic testing, so we can really customize this, especially if you've gone through pregnancy loss, if there's been complications. How do you be? And this is for I personally love this stuff too because it's really empowering. There's things you can do right now. You're in a very powerful position when you're on the fertility journey to make changes to your health that then will impact the health of your pregnancy, the health of your children, your children's children. Like if you kind of go down a whole line there, but.
Yes.
Yeah. So let's talk about, so many times people before they come to us, they've experienced multiple failed IVFs. They've had canceled cycles. They might've been told donor eggs. They've been through a lot. And a lot of times people have made those dietary changes. They haven't taken that very targeted approach. And so many people have had genetic testing with their fertility clinic. So we just kind of talk about how this testing is very different from the testing you would do at your fertility clinic and what exactly is the difference.
That's actually a really good point to start with, Sarah, because that is a question we get asked a lot. And you mentioned that part about this kind of testing being empowering. And in this fertility space, so important that you're investing so much in this area. You're investing emotion, time, and a huge amount of money. And you want to make sure that those eggs are viable the first time around. And one huge part about that is making sure that you are supporting these biological processes that we're speaking. So the genetic testing that we're looking at in this GrowBaby is actually focused on genetic variation that change how genes might be created, how enzymes might be functioning, and impact the biological pathways that support a healthy pregnancy. And as you said, beyond that. So healthy fertility, healthy dad as well, we'll get to that, but healthy mom, healthy fertility, healthy conception, the whole way through the pregnancy, and then postpartum, how that affects mom, supporting those biological pathways and making sure that whole time period is really supported as far as possible to then help the next generation. And so these genetic variations are not mutations. That's not the genetic testing that you do when you go to your IVF doctor, and they're looking at specific mutations, possibly syndromes that you might have risk for, and really big issues where it's almost a yes and a no kind of answer. It's very black and white. This is where these variations impact how genes and pathways might function. But it's this incredible science called nutrigenetics, where we're looking at the nutri or the environment together with the genetics and how these two interact to lead to a specific outcome. And that might be, improved fertility, better vitamin D levels, looking at progesterone levels, lipid metabolism, methylation, all these words I'm throwing out there, but all of these things that actually help support a healthy pregnancy. So it's giving insights into where an individual might have weaknesses, and then you can intervene at a targeted level.
Yeah, the point here is it's not like, oh my goodness, here's our genetic variants and being like, oh my goodness, we're doomed. No, there's things we can do to support, which is that knowledge is power side of things. So let's talk about the different. So why we're so excited about this test to begin with, and how it can really help you right now. So let's talk about how it can improve birth outcomes. Let me talk a little bit about that.
Absolutely. So there, in terms of what the test is able to offer you from really the insights, we want to make sure that there's some kind of measurable outcome at the end of the day. It's not just being able to say, we have these insights, what are we really going to be able to tell you? So the GrowBaby test looks at genetic variations in these biological pathways that then impact specific birth outcomes and helps to empower you to improve these birth outcomes, being looking at preventing or decreasing risk of preeclampsia and pregnancy-induced hypertension, looking at decreasing risk for gestational diabetes, as well as then preventing or decreasing risk of miscarriage and multiple pregnancy loss, as well as then, so that's obviously very much affecting mom. And then on top of that, these outcomes kind of trickle into the birth outcomes as such, being making sure that or trying to achieve babies born not too late, not too early, so just right on time, which is a really big factor when it comes to health. Also looking at making sure baby's not too big, not too small, so it's the right size, and then also improving resilience for baby and for mom. And that's got a lot to do with the stress around carrying, how stress hormones affect the baby in utero. So making sure that is managed as well as possible. And then during and after birth, that mental health is really supported through what we put in the environment.
Yeah, because so many times where we have this diagnosis that we deal with people that have low AMH and high FSH, diminished ovarian reserve, premature ovarian insufficiency, and we get kind of down this path of IVF and perhaps donor eggs and all this piece, and then we've forgotten to not that we've forgotten, but we don't realize that the health is the most important thing. And when we do get pregnant, we want to make sure healthy child, the healthy pregnancy, healthy baby, postpartum period. We forget about ourselves, the breastfeeding, all that, afterwards. And so let's kind of dig into a little bit with the pregnancy loss. Like this, we would work with people too with recurrent pregnancy loss. How can this decrease the risk or prevent the risk of pregnancy loss?
So there is really interesting research in this field, and this test is definitely targeted to mom, but it's always important to remember dad on the
Yeah.
side as well. And very interesting research coming in that actually you should be looking at what the genes are saying on the dad side. So pre-pregnancy and that preconception, actually possibly looking at other health tests, other genetic tests in this line that looks at the methylation steps. So things like MTHFR, your MTRR, those genes that encode enzymes responsible for creating methyl groups that then support the production and healthy DNA, as well as then looking, and that's where your B vitamins come in, and looking at requirements for those B vitamins, and not just, and the types of B vitamins, and not just looking at moms, but dads as well. So this test would be able to tell you, okay, around pregnancy loss, is it potentially something to do with how your methylation enzymes are functioning? Or has it, and then if it is that, then we know how to target those genes by supporting them with the correct doses of methyl Bs, other methyl donors, your choline being very important. And it becomes so much more targeted at a specific dose level. So you're not taking that basket full. It becomes extremely targeted to what you might need. Other areas that also or heavily impact pregnancy loss, it would be your vitamin D areas, as well as your progesterone. And so understanding if you have variants in receptors on vitamin D or in the progesterone receptors that impact how you're going to carry to term, or increased risk for a pregnancy loss, you know where to target your nutrient recommendation.
Yeah, because we have many people with low vitamin D, and we like it between 60 to 80 or a little bit higher. Conventional medicine, says it's normal if it's over 30, and people are in the teens or the single digits. And then, what's the reason for it being low to begin with? And then we're sometimes supplementing, but sometimes we're not supplementing. And then also studies talking about AMH, so anti-Müllerian hormone, being linked with low vitamin D, and so chicken or the egg kind of thing. And we get so, like, most people can recite their AMH and their FSH and their sleep. It kind of gets into their subconscious, and they're so, concerned about that. But like we're focusing on the wrong biomarkers here of, and trying to improve things. So yeah. Okay, we're going to dig more into this and a little bit more about pregnancy and loss and miscarriage as we go along. What about the reduce the risk for birth conditions? Like I've done some episodes on autism, but what, like, anything there? Because I think that's a real concern now. Like I go to a chiropractic care every couple of weeks, and I'm in there, and that my chiropractor, she specializes with children on the spectrum, and that place is full. Like, there are so many children in there. Like, she's helping so many children from that. So there's, obviously there's a whole sorts of reasons for that. But how
It's
can
growing.
we? Yeah, right. Which is
it's
heartbreaking.
growing. Well, this is one area where I think the test wants to tread very cautiously, because, as you say, there are so many reasons for being on the spectrum. Genetics plus environment, and so many different genetic variants that need to be taken into account. So in this test, we mention around stress resilience, and that's where it kind of fits in. So stress that the mom has been exposed to may impact how the baby handles those stress hormones at that very early stage. And where we're looking at genes such as BDNF, your brain-derived neurotrophic factor, nutrients that affect, as well as your MAOA, your monoamine oxidase genes. So those are genes, and that's a specific enzyme that's involved in breaking down these excitatory hormones. And as well as then some of your methylation genes as well. And so when those genes are not functioning so nicely, there's an imbalance there that could lead to just an altered ability to manage your stress hormones. And because of that, it leads to increased risk for being on the spectrum. When it comes to methylation, that's also got to do with hormonal control and your stress hormones, and your many of your hormones that impact or increase risk for being on the spectrum. So in that case, in terms of methylation, again, I think probably one of the biggest areas of this test, you'll see if you do it, it's very comprehensive. But there are certain steps there that if you're going through the whole journey of, oh, well, doing IVF and it becomes so clinical, you forget to really take care of the mom and preconception to take care of the mom. So some of those snips actually showing you the best time to intervene to decrease risk is preconception. And that's where you need to be taking those targeted nutrients. And that's around the methylation side. On the BDNF side, it's looking at timing of meals and the types of proteins you should be taking in. With MAOA, it's looking at stress management, looking at exposure to environmental toxin. And this is the other big area that is growing, is the area of oxidative stress and inflammation, and how exposure to environmental toxin can increase risk for, and that's something you can have a whole podcast on that alone, is the exposure to environmental toxins and how that interferes with normal gene expression, increasing risk again for being on the spectrum. So the test we trade cautiously because I think there are thousands of variants that you have to look at, and we are not saying by any means that if you carry a variant, this is going to happen. It's to say, how can we best support healthy resilience in mom and in baby postpartum?
Right, because we're in the middle of a toxic soup, like 85,000 chemicals we're exposed to. I was just on the way talking to my husband this morning all about GMOs and stuff like that. We're like, what? Like, we are exposed to so much stuff, and like that's impacting our endocrine system, our body, and it's so important to minimize your risk. Obviously, you put yourself in a bubble if you worry about it nonstop. But I think many people on the fertility journey have tossed out the plastics and filtering the water and do all these things. But this test will help us figure out this from just a granular level, so you know exactly what to do.
Absolutely.
Okay, and so let's talk about the different pathways there and what each one is kind of sharing, telling us, and how it can help. So the lipid metabolism. So what is that, and how would that knowing what's on that step is gonna help us?
So just taking one step into it, when we're looking at all of the pathways, we try to score the variants. So if there's a variant that you carry and it's possibly indicating a risk, we look at all of the variants within a pathway, and we then give you a score saying, is this baseline support for just like typical pregnancy recommendations, or are you going to get increased or elevated support in that area because you carry many variations within, say, lipid metabolism or one of the other biological areas that we're speaking about. And I think then it just simplifies the immense amount of information that comes to you in the report. So starting with lipid metabolism, what we're looking at here is one of the really important genes called ApoE. It's encoding your apolipoprotein E. You can get different genotypes on this specific gene, so your E2, E3, E4. And how you would look at it is if you've got an E2 on one side, it's kind of one side of how the enzyme functions. And on the other side, you've got your E4 and your E3, you're sitting in the middle. And you think of this as balance beam scale. And depending on your environmental exposure, both can actually have their benefits and their risks. And so when we're looking at an E4 individual, they tend to be a little bit more on the oxidative stress side. So more sensitive to oxidative stress, more sensitive to the types and the quality of fat, and actually almost possibly pushing in quite a lot of fat through that placenta to the baby. So typically what we see is with E4 individuals, there might be increased sensitivity to having sort of an unhealthier placenta. So that those environmental toxins we're talking about become very, very important to manage there. And also looking at the transport of lipids through to the baby. And so with your E4 genotype, it's very much about weight management and making sure that we're not pushing too much to get a baby that's going to be too long. Whereas on the other side, we've got your E2, and that's then looking at, in many ways, in an older individual, E2 could be protective. It keeps the antioxidants there. It speaks to other genes to actually help with the fats being transported really slowly, nicely, all with lots of care. But when you're carrying an E2 in with a mom, you may see that there's maybe a little bit less fat going into baby, and so risk for preterm birth or small for gestational age, because we really want to push those fats. So that's where you want to look at, okay, well, how can I actually help mobilize and support with specific nutrient cofactors the fats coming into baby? And that's, I think, an example of how personal this information can become.
Yeah, then the report will give you, so it'll give the diet, the lifestyle, and some supplement recommendations. Can you give us maybe for the one that has like a smaller size? Like, is there any kind of will be some high level diet and lifestyle and supplements for that step?
Yes, definitely. So things like with helping, especially with the transport of those fats, we're looking at your selenium, which will be really important. And so that in terms of a specific nutrient. So we'd say, okay, well, selenium in a certain amount would be a safe supplement to provide. So take that potentially in a dietary supplement. And then on top of that, look at your selenium-rich foods. I always say instead of taking the supplement, if you've got your hands on some good quality Brazil nuts, you can actually get it in from there. So instead of putting another pill in your basket, just eat those, and then you take 2 or 3 of those a day, and that's literally meeting your requirements. So that I would say is a really important one. Things like your phosphatidylserine, also very important with the fat transport. So your phosphatidylserine, phosphatidylcholine actually coming up quite a lot whenever you're seeing these variants as really important nutrients to focus on. And then looking at things like brewer's yeast, and then because that has all of these nutrients in them, as well as egg yolk, which is a great source of your choline and your serine. So I would say those in terms of the nutrients on the nutrient-based foods, and then the specific dietary supplement would be your selenium. But get it through the Brazil nuts if you can. It's easier. And then in terms of lifestyle, that's just really where we're trying to maintain baselines. So not too much to worry about there. Whereas if you were E4, there would be a lot more around lifestyle, weight management, exercise, and then keeping a very clean environment, watching for that toxin exposure, looking at your apps and seeing when the pollution level is high. And maybe on those days, putting up the filter, wearing something where you're not actually being exposed so much. So again, becoming very different based on the genotype that you carry.
No, that's very interesting. Yeah. Okay, so let's talk about inflammation. This is one where I think we all know, like, oh my goodness, I'm probably inflamed, or that this is all the stuff we talk about with the food sensitivities and the gut infections and the mental emotional stress, all that causing inflammation of the body, and that may be why the body's feeling in like fight or flight. How does it get to the parasympathetic so it knows it's safe? So inflammation, what are we seeing there? And then we'll talk about some of the strategies to help with that one.
Definitely, and I think this is actually coming up as probably the root cause of everything, as you say. And so here we're looking at a bunch of variants on a gene called IL-6. It's your interleukin-6. It's this pro-inflammatory cytokine that actually promotes the production of your CRP. So you might measure high sensitivity CRP, a really good indicator of your chronic low-grade inflammation. Actually coming up with a lot of the psychiatric illnesses as well. That's one of the markers that they're looking at. And in pregnancy, it's already a bit of an inflamed state. So you're carrying this foreign body. So your body is under, your immune system is a little bit more on high alert, and things going on a little bit differently. And inflammation is also, and for good reason, but when it's too high, and this is where those variants switch this gene on a little bit too much. So it's just active and it's reactive to everything. Leading to increased and inflammation, the big problem, and then it leads to increased risk for a higher immune response, autoimmune response, as well as then increased oxidative stress. And we don't want a lot of oxidative stress when we're looking at a healthy placenta. And this has been then associated with things like preterm birth or small gestational age. And so again, how can we manage that inflammation if you do carry these variants?
Yeah, we see a lot of people that have the fertility diagnosis, and they'll say, oh, by the way, I have Hashimoto's or celiac, or I've got lupus, or I've got, rheumatoid arthritis. So something, inflammation in the body. And then they're put on all these different medications. Well, the best thing for this is diet and lifestyle changes in a targeted manner to help improve it. And then, like we said, to reduce the inflammation. Any kind of like the diet or lifestyle or any recommendations there, supplements to help with inflammation? Was sort of we seeing an outcome from the test?
Definitely. And I mean, I could really speak about this for a long time, but I think some of the key ones just have shown such great evidence over many years is your omega-3 fatty acid, making sure that's in there, and a good quality. And so I would say, supplement, and then if you can get the fatty fish, it's responsibly sourced as well as then your vitamin D, and those go together so nicely. And you talk about autoimmune diseases. There was a really nice study done, an RCT, looking at the long-term supplementation of vitamin D and omega-3 together, and how that decreased risk of developing an autoimmune disease in individuals with a strong family history as well. And so showing that it's actually working on suppressing that inflammatory gene expression. So those two I would say are just like really key. And then on top of that, something else is if you think about your blues and your reds. So from the diet, what can you do to really put in all of your blues and reds, your pomegranates, your blueberries, raspberries, anything blue and red is going to significantly modulate how those inflammatory genes are expressed. And then, of course, how can we avoid the pro-inflammatory? You spoke about celiac. So it's your gluten, it's all your food triggers. Anything that if you're looking at food sensitivities and you're going to be sensitive to that, it's going to aggravate the inflammation. If you're looking at being overweight, high fat percentage increases the amount of these pro-inflammatory cytokines. So we do need to look at what can we avoid and how can we just put our body into a bit of a bubble, looking at stress management, especially looking at your deep breathing and your gut health, and putting in those probiotics and the prebiotics. But then I would say your stars would be your omega-3 fatty acids and your blues and your reds.
And sometimes people with the weight piece, like they've typically, someone's trying to lose weight, they have tried everything. They've made all these changes, and then they could be I see people that aren't even eating a lot of food, right? They're eating maybe towards the end of the day, or they're exercising. How does this help with someone not beating themselves up? You can kind of see your genes, if there is inflammation going on there. Well, maybe that's why the body's holding on to this extra weight. Is there anything you want to say there?
It's exactly it. I think from the next section that we'll be talking about is probably detoxification. And I think these two really feed into each other when it comes to the barriers around weight management. So one, there are some genes and we've got a test looking at that. There are some genes that just predispose some individuals to being more overweight. And maybe it's not about just cutting calories, but it's the types of foods you're eating. So if you're eating one meal a day, but it's a pro-inflammatory meal, that's not going to work. If you're eating one meal a day, but you are highly stressed and your cortisol is all over the place and you're not sleeping, forget about losing weight. So it's one of these other factors besides just the old school dietetic way of thinking, calorie in, calorie out, and why aren't you losing weight? And I think these are the things that are so important to keep in mind, and not to beat yourself up about it, but to consider yourself as, then it's multifactorial.
Absolutely. Okay, so we can do detoxification next, or methylation. Where do you want to hit?
I'm excited about both of them, but as I mentioned, detoxification. If we're talking about detoxification, it's actually divided into two phases. Your phase one, which you can consider your activated stage. You see the toxins coming in, activate these to sometimes become even more reactive. So you see something like a smoke particle, if you're eating smoked foods, alcohol, it gets activated into its intermediary stage. And that intermediary stage can often be more reactive and harmful to the body. And so our phase two needs to come in and neutralize these reactive molecules as quickly as possible. And if there is an imbalance between phase one and two, or if there's just high overload from the environment pushing phase one, there is going to be increased risk for oxidative stress again, and damage to the body. And this toxin overload is going to lead to increased risk for mental health disorders. You might often see it as like skin rashes, skin sensitivities is a really big one. Your asthma, atopic asthma coming through there. And then in terms of phenotype risk, these areas are quite large. It ranges from your recurrent pregnancy loss, gestational diabetes, toxins actually increasing risk for diabetes. So don't always, individuals think, oh, it's the overweight, or I've done everything right, it seems, but I'm still being diagnosed with gestational diabetes, and it may be this toxin overload. So that a really important one to look at: preeclampsia, pregnancy-induced hypertension, and then in your and so with that, it's looking at how you can best these.
And then, so we see a lot of people with, the skin issues, hives, rashes, acne, like great skin, and all of a sudden you got adult acne, you got psoriasis or dermatitis, and then you're taking creams and all this sort of thing. Plus you're dealing with people on the, you're on the fertility journey, and then also the mood piece, where people taking SSRIs, and you think you're an anxious person or an irritable person, and then as you start to support, your neurotransmitters, and then these things come back online, and sometimes medication can be part of it, but it otherwise it's just like a Band-Aid approach. And some people, they focus on this fertility diagnosis, or and then we're not looking at the rest of the body. So like in this case with the detox pathways. So is there anything you want to say from like a diet, lifestyle piece on detox, things they can do?
It's so important really to support this. I think something that comes in, especially on the fertility journey, and if you can catch them in that fertility phase, is to try to get as much right before pregnancy. Because, as you say, it's they focus on the diagnosis instead of looking at, okay, well, what else is going on that's driving that kind of toxic load, and the thing about decreasing the toxic load, it's obviously one, getting yourself into a clean space, but also then, okay, how can we get rid of the things that are kind of laying our system quite heavily? And that is where it may be better to do it if you can pre-pregnancy, because it can be a journey to detox, and it can actually lead to some unwanted symptoms that you're not so keen on in the beginning, and you have to be in a space where you can get so things like, and one of the best detoxification foods are your cruciferous vegetables. You've got your great nutrients that can be taken as a supplement there as well, including your sulforaphane and your diindole methane. But during pregnancy, you would want to be much more cautious with that. So doing it pre-pregnancy, getting yourself into a place where you're really in a good space, and then during pregnancy, looking at your supportive nutrients, including your magnesium, your B vitamins, obviously being super, super important, enough protein to help with the transport, because we need protein, and that's how we can make our glutathione, this great detox nutrient. And then I would say you could also probably supplement with the glutathione if you're not getting it in sufficient amounts through dietary intake. So I would say those are the nutrients that would be really important. Obviously, the foods alongside that, your cruciferous vegetables, your allium vegetables. So looking at broccoli, cauliflower, kale, onion, garlic, getting in those, your celery, lots of phytonutrients from colorful fruits and vegetables, and then clean eating as much as possible. Looking at possibly, again, pre-pregnancy, it's your saunas, things like that. And during pregnancy, it's just making sure you're doing exercise daily, and in surrounding yourself with a clean environment.
Great. Okay. And then the next one is methylations. We've done many podcasts on methylation, on making sure you want to take a methylfolate instead of the folic acid, the synthetic form, MTHFR, gene variant mutation. So when many people, like 60 to 80% of people are said to have this. So let's talk about methylation, why it's so important with pregnancy loss, and talk about some other factors there. What are you seeing?
Definitely one of the biggest areas, and I'm glad you've covered it in many podcasts already. So to discuss this, why it's so important, it obviously, with methylation enzymes, I mentioned that it's about creating your methyl groups that then can be donated to help with DNA formation, help with protecting your genes when they should be switched on and off. And if we're thinking about developing a child, there's a lot of switching on and off of genes at the critical moments that need to happen. And this is where methylation becomes so important. to the point where, I mean, this is now a mouse study that I'm using as an example, but we if you look back to the Dutch famine studies and how important that transgenerational health is, that's because your methyl groups weren't available to those moms when they were pregnant. And those children, now adults, are having increased risk for cardiovascular diseases, diabetes, etc. So that's how important that switching on and off of genes is. And the same thing when you can do it in a very controlled environment. You see mice who have a gene that actually expresses into, we call them the agouti mice. They're fat and they've got metabolic syndrome. Then you feed them, these pregnant mice, you feed them either a mouse diet or you feed them a methyl-rich diet. And those getting the methyl-rich diet actually have babies that don't have this expression of this agouti gene. They're actually small brown mice that are healthy, and it's because those methyl groups have covered that gene, so it's not being expressed. And so that's how important this methylation process is. And if you're thinking about how that might then increase risk for miscarriage or and pregnancy loss, if you've got genes that aren't switching on and off at the right time, if genes aren't being created appropriately, there is that significantly increased risk. And that comes with genes like MTHFR, TT, and all of that. I'm TT for MTHFR. And looking at my husband, I was doing the sum. But, then it's just about putting in the correct intervention and you actually end up, everything can go really smoothly. So knowing then that these risks are associated with things from preterm birth to gestational diabetes, hypertension, the pregnancy loss. Again, looking at fertility, both mom and dad, the neural tube defects, the genes need to close those myelin sheaths. So I think every area that you think about in a healthy pregnancy, methylation.
And what about some diet and lifestyle and some strategies there for people?
So you mentioned the methylfolate. We know that now be hopefully a given. And on top of that, it's avoiding folic acid. And so not just providing the methylfolate, but looking at foods that might be fortified with folic acid, because a lot of it is not, especially if you have the variants, it can't be properly kind of processed through the body, and it ends up sitting in the liver as an oxidized product. And we don't want that. So it's also looking at where we can avoid the folic acid. And then looking at, obviously, not just methylfolate, but your whole host of methyl donors. And I can't stress proline enough. So if you like your egg, get them nicely cooked, obviously, and during pregnancy especially, but looking at those proline requirements. You could also obviously supplement with proline. I think that should be definitely within a good prenatal is your Fab Fertile proline. And supplemented throughout and during fertility stage as well. Then your B12, your methyl B12, your B2, your B6 needs to be in there. From the food side, getting your dark green leafy vegetables, getting your betaine-rich foods, and then avoid anything that's going to kind of sap those B vitamins as well. So looking at stress, avoiding stimulants, looking at the caffeine, and then supporting good gut health.
Yeah. So I was going to say something in there about what was it? Oh, it's skipped my mind. But yeah, it's obviously the gut health is we work with people. Have so many infections with the microbiome, and you're passing fluids back and forth. So couples have a similar microbiome. But the methylation piece is key. It is it's quite a complicated. Oh, that's what I was going to say about the egg piece. So the eggs are like a top allergen. We see so many people are intolerant to the whites, and then they're pounding down all these eggs. So we need to. So I guess if you have a sensitivity to eggs, then you could then supplement, because we just see that as one of the top allergens. Yeah,
and that's such a good point. Thank you. Yeah.
Insulin sensitivity. This is something that we see all the time. People with mood swings, feeling hangry, feeling poor sleep. And then it impacts their ovulation, their menstrual cycle, and they've got insulin sensitivity. So let's talk about that pathway. What do you see in there?
Definitely a really interesting one. And I would almost couple this actually together with your melatonin metabolism, because interestingly, and you're thinking mood swings, sleep, all of that, it's the melatonin metabolism together with your insulin sensitivity SNPs that increase risk for gestational diabetes. And there's actually been some very interesting research that our partners with this GrowBaby test, the GrowBaby Health team, who were integral in developing this test, they've been doing some research in the state using this test. And I think a variant that's just coming out time and time again from their field research together with what we're seeing in the literature is this MTNR1 beta. It's one of your melatonin receptor SNPs that actually influences how your insulin is secreted, when it is secreted, and a significant predictor of gestational diabetes. So I would say that together with some of your insulin sensitivity ones being really important. And then just in terms of your insulin sensitivity ones, genes related to how zinc is transported, that then influences your insulin sensitivity. So I think with this area, again, think beyond just, I need to, make sure I'm eating a lower carbohydrate meal, or I'm focusing on timing of meals and things like that, but also focusing on the nutrients that support insulin sensitivity. So with melatonin, we want to make sure the tryptophan is there. Tryptophan makes serotonin, which makes that melatonin. We want to make sure that we're getting adequate sleep. We are regulating our body with, our day-night cycles, because that's really a very important predictor. And then we're looking at things like your other nutrients, your zinc, looking at exercise being actually more important than just focusing. Obviously, your meal timing and the composition is important. But I think going beyond that is what this test is able to give you.
Yeah, it's interesting too with the melatonin, because a lot of times there's studies came that said that melatonin can help with IVF. So people are pounding down all this melatonin, but maybe you don't actually need it. And we see when we do a Dutch test that their melatonin is sky high. And if yours is low, it could be due to gut bugs or microbiome issues. Anything you wanted to say about melatonin in particular?
No, that's actually such a good point. So thank you for mentioning that. And again, melatonin, great, but it's the receptor that you need to support as well. And so the main or the first line therapy to intervene on this receptor is not saying pound the melatonin. It's actually looking at, okay, focus on your day-night cycle. Look at your magnesium, because magnesium is going to support this. So actually your magnesium being one of the more important nutrients here to support the receptor before you just only give melatonin, which could then also disrupt things. So it's really important, I would say, to look at it beyond just the typical and again, just being related to that gestational diabetes at large for gestational age and going beyond the go-to nutrient.
Anything more lifestyle or supplements they can look at on that one?
So, I mean, you've got anything to calm you, so avoiding your stimulant, your chamomile, looking at that. Stress management being really important. And then it's your magnesium and your magnesium-rich foods.
Yeah, I can't tell you how many people I talk to. I'm like, how's your stress? It's an 11. It's like off the chart. Like just, let alone going through the fertility journey, depending on what the people have been through, and then life itself. And so many people are working full time, going through IVF, and then now's the time they decide to do a graduate program. Let's add it all in. We're going to do it all together and wonder why we feel stressed. Because just because we're type A doesn't mean we need
to do it before the baby.
Right?
Just get it all the baby covered.
Yeah, so much stuff. So it is to be, we don't need to be doing it all, and we can kind of do things in small steps here. Vitamin D. So we did talk about the vitamin D. So we have people do vitamin D3K2. And we do see, like we were talking about before, we do see it low. So and also that study we talked about with AMH. So what are you seeing with the pathway vitamin D, and what are some recommendations?
So this one, we're looking actually at the vitamin D receptor. So once you've got the vitamin D in, how is it actually attaching to that receptor? And that receptor then leads to actually the activation of thousands of genes downstream. So we really want to make sure that receptor is working well. What this can tell us is, one, our responsiveness to supplementation, which is a really nice one as a practitioner to know, and obviously as the patient, because you're taking a supplement. And why is your vitamin D not going up? There are certain individuals with these variations that you can see smaller incremental increases with supplementation. if you carry these variations. So then you know, okay, I need to push it a little bit more, maybe actually go a little bit higher and test more frequently to see where you're at. So that one being really important. And I think just from a practical side as a practitioner, really nice to know. What I mentioned already is related to the autoimmune disorders, but then also looking at if you've got adequate vitamin D during pregnancy, how that affects the risk for asthma and autoimmune disorders in your child. And it can significantly reduce those risks if your levels were on the high end, not in the teens and not at 20, but much higher than that. So that being really important. And then obviously the two other areas that we're wanting to avoid in this very critical time period is your preterm birth and your small for gestational. And so you definitely need it there around for that.
Any lifestyle and diet strategies there for this one?
So
Sunlight?
This one, sunlight, get it to the sun. Don't be scared. You really do need to get that sunlight there. Otherwise, also looking at your small bony fish, things like mackerel, herring, and most of your cold water fish. And then as food sources, mushroom is in the D2 4. So a nice way to actually activate the mushrooms for those who are less on the meat and fish eating side. Obviously, the supplement I would say is then an absolute necessity. But you can put your mushrooms, you cut them up, put them out in sunlight for a bit, and it does the same thing. And then you can eat those. So that's a nice way to get those in. But I would say sunlight and then supplementation. And you already mentioned it's the D3 plus the K2. And it's the combination that you.
And then the last one is the progesterone metabolism. So I think people that have experienced loss, this is sort of the one that the medical community is like, okay, let's supplement with this. And typically not the first time you've experienced it. It's usually they're not even testing until the third, right? Which is crazy. People going through all this trauma of pregnancy loss. Let's talk about the progesterone metabolism and why that's so important.
So this is, definitely, and I think this is the one area where I would say it moves a little bit outside of our diet lifestyle recommendations, and the recommendation becomes a little bit. It's much more medical, and you'd need to have a prescription around it. Obviously, this being so important, hormonal balance in pregnancy, so important to hold on to that baby. What we're testing for here are the progesterone receptors. So not necessarily just the level, but actually how that progesterone attaches to that receptor. And so if you do carry variants there, you may need to be prophylactically starting your progesterone. And that, I think, is where you're saying, oh, they're testing third or fourth time around. You're starting right from the beginning and you've got a receptor that is not working so nicely. From the beginning, know that you need to intervene, and it would be the prescription of the progesterone, and that's to really just actually hold on to that pregnancy. So it's one component, and you say that's where the medical fraternity normally goes to. Obviously, a really important part, and so easy to know about it, and to intervene straight off the bat. But I would say there's so many other areas together with this one, and it shouldn't be the primary focus.
Anything on a lifestyle or diet on that one?
It's progesterone.
It's progesterone, okay.
Yeah, it's progesterone.
And what about the dad as far as looking at testing for health? Like obviously we're coaching couples. It's really important. People sometimes, the woman has done all these changes. They've tested her backwards and forwards, and I'm like, hey, how's his semen? And then no one's even looked at his semen. Now, if they obviously they've been through IVF, they've tested semen. But if they've trying naturally, and funny enough, I'll say to the guy, how's your semen? He's like, well, it looks fine. I'm like, no, did you get a test? So, which is like, they don't know. Like, sometimes you just don't know that you got it tested. I think, more people are understanding that it takes two on this equation. And especially like looking at your, DNA fragmentation and not just getting a little test off of Amazon and going, whoopity-doo, my count's fine. And then obviously, like, we've done podcast episodes on talking about how counts have like declined by, I think, 40% over the last 50 years, just like a craziness what's happening out there with how how this is affecting men's semen. So we can do a whole entire episode, talk for hours on this. But like, why is it important for the male to get the genetic test as well?
So many good points. And so to add to that, I would say this test, in terms of how the recommendations have been laid out, it's very much focused on female health, and just the research is obviously stronger in that area. So we've made it very much accustomed to the women and to mom to be. But on the dad side, you've got those other tests available to you. You've got DNA health available to you, which is looking at all of these biological, or many of these biological processes, but with more overall advice in terms of just longevity and supporting the biological processes. If we're looking at the research around this, we can see there's been some interesting studies, small, but looking actually at RCTs, looking at these methylation SNPs, and not supplementing mom only, but supplementing dad as well with your MeSALB, good doses, and your COLI. And those who had the variant, some who were then supplemented, their chances of falling pregnant naturally were higher. With IVF, they had better uptake, and then for carrying to term. There's also research looking at the methylation SNPs in dad, and if those nutrient pathways aren't supported, increasing risk for miscarriage in mom. So mom could be, you do the test and everything's fine. You have to look at dad as well. So it's, and that's, perfect. It's half when it comes to that side of things. So that's your methylation. Your vitamin D, again, being really, really important in terms of semen health and quality, just extremely important. And then another one that we're looking into, and there's some very interesting stuff coming out, is around your detoxification variation and toxin exposure. And there were some studies done actually in some areas, so high pesticide use, agricultural areas, and testing semen when they just at baseline with the high exposure, and then post-intervention where it was removing exposure and then support with your phytonutrient-rich diet. And then and those individuals who carried the variation, they were more susceptible, one, to the high pesticide exposure, but then saw much better improvements in that semen quality when that exposure was removed, together with extra support. And so would say, just in terms of, again, that toxin exposure, huge when it comes to both dad and mom, and that's alcohol as well.
Yeah, I think people on the fertility journey know alcohol, but yeah.
No alcohol, Dan, no alcohol.
Right.
Too.
Yeah.
Not
and not about
mom.
nagging your partner. This is why we coach couples. He's got to work on his, not to say that the guy that's drinking, but okay. And we've seen many many farmers actually doing some of our testing with the hair tissue mineral analysis and things like that. And I'm like, my goodness, the pesticides. So if that's a farmer, what about us that aren't farmers and we're eating all this stuff? Anyways, that's a whole other topic, but
that is a huge one.
Yeah. So what are your final thoughts here on the test, on really having people, being empowered? Yeah. What are your final thoughts today?
So I think, I'm really excited about this. We're actually working on it was developed actually at the same time as I had my boy. And so it's become my baby and my baby. And so now it's time for, just putting a little bit more work into it to see where the research has developed. From an empowerment point of view, we've seen from these small clinical trials we've been doing with it that the motivation is much greater. The information is empowering. There's nothing scary in here that's meant to say to you it's black or white and it's doomsday. It's to assist in promoting healthy pregnancy, healthy outcomes, transgenerational health. And I think that's one of the biggest things you said in the beginning. But to really emphasize on that is that you obviously want to fall pregnant and carry to term and to have this healthy baby, but you want that healthy baby to turn into a healthy adult, to have healthy children. And I think this is where there's so much value in this test to be able to support these biological pathways. Our transgenerational health goes back generation. And to start with a healthy baby, having another healthy baby, I think is so empowering. And being able to, just be a part of a very exciting journey is very encouraging for me, and it's a privilege to be part of it.
I love it. Thanks so much. Excited about this test, and thank you for giving us some insight. I appreciate it.
Thank you, Sarah. I appreciate being on the show.